Hey there. In this video, I want to address knee replacement pain or pain around the knee after a knee replacement. Hi, welcome back. This is Elbu, your exercise physiologist. So, if you have already done a knee replacement, maybe recently or maybe years ago, and you're still feeling pain around the knee, don't worry, because the surgeon probably did a good job as long as you can move around. It's not stuck, it's not giving you any other problem, you're just feeling the knee pain. Let me explain to you why the pain. Now, if you look at the knee joint, there are many structures. If you're talking about the replacement, they probably just, whether it's a total knee replacement or whether it's partial, they just do the surgery around the knee. The problem is with this is depending on the procedure that you have gone through. Most of the time, you have to be sliced open. I don't think there's any technology or any surgery out there right now that can replace a knee without cutting you up, right? So they have to cut you up, and when they cut you up, and if you have looked at how we cut steaks, lamb, chicken, pork, we cut through the muscle. We cut them into smaller pieces before we put into our mouth, right? It's the same thing when it comes to surgery. They cut you open, they got to make sure that it's open up, then they can access the knee, right? And when this cutting happens, the muscle is affected. And yes, the muscle does heal. The muscle, tendon, ligament does heal, but you can do more to help speed up this healing process. And that is why there is no surgery that you can go through without a post-surgery rehab. Now, this is the key. When you go through your rehab, you cannot be doing very general exercises to strengthen the knee because there are many other muscles being affected. Depending on how you walk, depending on how you function, different muscles are going to get affected. So the gait come into place. GAIT, okay? Your walking gait comes into place because when you still feel pain, you may try to walk a little bit different and different muscles get to work. Or there is actually muscle imbalance. The stronger muscles takes over because the weaker ones are still recovering and they have got no strength. They will do the work most of the time, okay? Or what we call compensation, because although they are not supposed to do that kind of job, they will do it anyway because the other muscle can't function. So the purpose of going through the rehab is basically to slowly activate the muscle because it requires knowledge in terms of getting the muscles to activate and then slowly strengthening. For a lot of cases that I've seen is because they jump straight to strengthening and it's a different intensity that person can cope with, so it becomes a lot more complicated down the road. So it really depends on what situation you're currently having, whether you feel the pain after a few years or whether you immediately, after the surgery you still have pain, because you have to be activating the muscle in different intensity that suits you. So the person doing the rehab has to know, and you slowly build the strength from there. Now, This is where it gets complicated, because when you have a tight muscle or overworked muscle, it can cause you the knee pain. If you have a weak muscle and you stress on it, it will also give you the knee pain. So this game is about balancing the muscles to make sure that all of them can fire each time you do a very general strengthening work. So all of them has to start from the bottom and you work all the way up. You can't be working straight away here because the stronger one will do the job. So if you have a knee replacement, you want to make sure that you get the job done properly. And what I can tell you is, if you went through so of course, other than the person helping you with the rehab, you are the main source or the main factor that can cause you the pain. If you're not diligent, exercises are given to you, but you haven't been doing, because at the point you don't feel pain, and then all of a sudden, or months down the road, or even years down the road, you start to feel pain, it is your fault because you haven't been doing them. Okay, so who you see and who you are makes a lot of difference. So people that I see, I usually warn them ahead because I set the standard high. I want to make sure that they are committed and they want the best out of themselves. So when I prescribe the exercise, I have to make sure that they are doing it. They have to make sure that they are doing it. So there may be documentation as well, because I want to see also when my patient is doing it, they are actually doing it properly, or they can actually show me when it comes to the next visit. Okay, so really it depends a lot on you, because the surgery is usually replacing that part, that spare part, but the rest of it, the aftermath of the surgery, is entirely up to you now. Okay, so you got to be strengthening it, progressing it slowly, and the fastest for rehab, I have to give it to athletes, because they have to get back to the game and they usually try to be very diligent to make sure that they have no problem with all functional tests before they get back to the game, right? So this is it for knee replacement pain. So now you kind of know you need to fix it. There is nothing wrong inside the knee. It is the muscle. Okay, so please take care and I'll speak to you soon. Bye bye.